Let's say you are part of a sports team training a few kids to play football. One of the kids developed sudden muscle pull in the back thigh. As a coach or a trainer or a therapist, what is your role in providing on-field immediate treatment in the acute phase? If you are looking for answers to these questions, then you are in the right place. You are in this NPTEL lecture on acute phase of rehabilitation, goals and strategies. With me, Wing Commander Dr. Chandrasekhar Guru. I'm a sports medicine physician. I'm an associate professor in the field with the Department of Sports Medicine, Armed Forces Medical College, Pune. In this lecture, the learning objectives will be to focus on the goals during the acute phase of rehabilitation. What are the aims, goals, and understand the principles? What are the strategies that are employed to achieve these aims and goals? And what are the practical aspects with some examples? The main aim of phase 1 rehabilitation is to prevent further damage and restore limitations. So, the first and foremost goal is to protect the injured area, control the inflammation, pain management during this phase, and finally to achieve or maintain the function. So, as we have seen in the previous lecture, it is important to understand the principles of tissue healing. We'll just quickly recap the tissue healing principles. As the injury progresses or the body's response to the injury progresses over a period of days, the initial phase wherein the body immediately responds to the injury by pouring a lot of blood cells and blood flow to the injured area in and around the injured area is termed as the phase of inflammation. This generally lasts to 3 to 7 days. This is the phase wherein you have 5 cardinal signs of inflammation which the patient actually experiences. They are redness, swelling, increase in temperature, pain, and loss of function. So, this is very important to be addressed during this particular phase. Subsequently, the phase progresses into the phase of proliferation, wherein the laid over initial layer of granulation tissue is further kind of laid, multiple layers are laid, and then that helps in kind of going into sort of maturation. So, that moves into a phase of remodeling, wherein the laid down tissues get remodeled to reach to a state which was in the pre-injury state. So that's the stage of or a phase of remodeling which starts generally beyond 3 weeks and then continue depending on the type of tissue. So the phases of rehabilitation we saw are aligned as per the principles of inflammation and tissue healing. So we have different phases. The phase 1 is mainly to address the acute phase wherein to prevent further damage and to address the impairment that is caused during the immediate injury phase. The phase 2 and phase 3 are subacute and return to sport, which will be covered subsequently. So focusing on phase 1, it is mainly focused towards control of inflammation and cut. Covering it again. The phase-wise target, as we have seen earlier in the phase 1, the initial target is in the phase 1 is mainly to focus on the controlling of inflammation to prevent further damage, modulate the pain, and thereby increasing the range of motion. So that must be the immediate target in phase 1. Subsequently, also focus on activation of proprioceptors and the joint stability and initiate a stage of kind of motor control. Subsequently, also kind of initiate activation of this inhibited muscles around the injured area in terms of simple activation exercises. So the exercise therapy in phase 1 is predominantly controlled so that it is a balance between preventing further damage as well as to hasten up the process of healing. So, what are the strategies that are employed in phase 1? It's very important to understand these strategies and use in your practical on-ground exposures. So, the main goal is to protect injured area, right? So, the strategy here would be to use the acronym which we have already mentioned in the previous lecture, PRICE or POLICE. P stands for protection, R is for relative rest, or it is now been replaced contemporarily as optimum loading. I is for ice, wherein you apply ice. C is for compression around the injured area, and E is for elevation. Generally, the limb elevation is done. So, protecting the area is mainly to avoid disruption of the fragile, newly laid tissues by the inflammatory cells. You immediately advise the individual from carrying out the activity, or stop the individual from further doing any activity. So, that itself will protect the area. Second aspect is you can also use some aids to kind of protect the area by using some bandages or wraps or braces, so that that restricts the movement and hasten up the process of healing. For example, in ankle sprain, it has been evidence based practice, I would say, is that to immediately use an ankle wrap during the acute phase, so that that reduces the formation of further increase in the swelling and controls the inflammation aspect as well. So thereby the recovery is hastened up. This is a very good level of evidence that is available for this particular fact. The second important strategy is controlling the inflammation. How do you control the inflammation? It's again the same. When we go one by one, when we say applying ice, what ice does? Ice basically controls the pain. It numbs the area, thereby the transmission of the pain through the nerve fibers is reduced. So that is again controlling the pain. Second aspect is it also decreases the metabolic rate at that particular area because of the decrease in the temperature. So that reduces the blood flow, vasoconstriction, so the swelling is also reduced. And you use C for compression. When you use compression in terms of say applying what do you call a bandage. So when you use a bandage from distal part to the proximal part, so you are giving some compression so that you don't allow the excess blood which has come to ooze out in the extracellular space. So thereby that also prevents increase in the further swelling. And the third important aspect is the elevation. When you elevate the limb, because of the anti-gravity nature, the blood flow or the fluid is drained back from the area where it is injured. So by this mechanism, you are trying to control the cardinal signs of inflammation. And more importantly, you are also protecting to avoid further damage. So you are unloading the stress on the injured site. That's how you are controlling the inflammation. More so in soft tissue injuries, it's important to also have certain amount of optimal loading. So optimal loading causes kind of it is a balanced activity wherein you are not promoting complete rest, as well as you are also not increasing the load in such a way that it disrupts the newly formed fragile granulation tissue. So that optimal loading helps in kind of hastening up the process of healing as well, and it increases the vascularization. One way of doing it is by introducing endurance activities. Say if you have an injury of the ankle, you can avoid weight bearing activities. Rather, you can go for a simple um, a circuit training program on a seated surface using the upper body. So that itself will increase the cardiovascular activity. So thereby it increases the blood flow as well. And the fourth important is the uh, exercise, which is the therapeutic exercise in a controlled way, so that you promote the healing process. However, one important thing that one should keep in mind is that during this acute phase, you should not do no harm. So this is again an acronym. It is application of heat is a complete no-no, because as we know, because of the inflammation itself, because of the chemicals, and due to the injury, a lot of blood cells coming up, secreting a lot of chemicals, which in turn increases the vasodilation, which increases the blood flow. So that is already there. So when we apply heat, it further increases the vasodilation and further increases the more blood to the injured area. So that may cause increase in the swelling as such. So increase in swelling further will compress the arteries and the veins, thereby compromising on the further optimal or efficient blood flow in removing the waste products from that particular region. So that will kind of counter the healing process that is happening. Alcohol, again, alcohol is found to further reduce the healing process. And R is for running. Running is a kind of an analogy. Any kind of activity should be planned in a balanced way so that it doesn't further load or stress the injured region. And M is for massage. Massaging traditionally or indigenously, generally massage is what we generally do. Again, massage is shown to increase the local vasodilation of the skin and the subcutaneous tissue, which further increases the blood flow. Also, it's seen that during this time there is a lot of laying of the collagen granulation tissue is done. So doing a massage may kind of interfere with the laying down process and may cause disarray in the collagen laying process as well. So it is better to avoid massage during the initial acute phase. Moving on to the next goal, that is pain management. So one of the important aspect of acute phase is the pain. Pain is the most common symptom which brings the individual to the doctor or therapist, so that that's a protective response, right? So pain management is important. Why? Because if the individual is in pain, the individual is not going to continue with the therapeutic exercise that you advise. So it is important that we control the pain. Some amount of pain is obviously required, but then an extreme level of pain is not going to allow a positive outcome. So it also has a psychological impact. So it is important to manage pain. How do you manage pain? As we discussed earlier, application of ice, it numbs the region and thereafter decreases the nerve transmission. So that also reduces the pain sensation. So how do you apply? 15 to 20 minutes of ice pack. If it is an ice pack, don't apply directly. Wrap it on a thin towel and then apply it over the region, and should be continued every 2 hours for about 3 to 4 times in a day, at least for the first 3 days. So first 3 days, it is important that this particular ice application modality or the strategy has to be undertaken. If you have access to physical therapy department or electrotherapy modalities, then electrotherapy modalities also can be used to modulate the pain. So one of the commonly used for muscle related injuries and spasms or cramps, where pain is predominant symptom, where you can use transcutaneous electrical nerve stimulation, which kinds of use the pain gate control theory to kind of activate the different nerve fibers, and that reduces the pain sensation. So reducing the pain is not a permanent solution, but then reducing the pain increase the confidence, and thereafter the individual gets motivated to do the therapeutic exercise, which is the mainstay of treatment. So that's how pain control is important. And other electrotherapy modalities also can be used, like interferential therapy. Analgesic, another important aspect is analgesic. Analgesic action, you can give simple paracetamol itself. Paracetamol at an higher dose of 650 milligram has a good analgesic effect. It can address the pain sensation. So centrally it can reduce the pain sensation that you have. People generally, which is over the counter available, is the NSAIDs or the non-steroidal anti-inflammatory drugs. So what is the evidence? Because since it is over the counter and pain is the predominant symptom, people generally tend to overuse the analgesics. However, evidence clearly shows that chronic use of analgesic or prolonged use of analgesic in musculoskeletal injuries is shown to decrease the strength that is developed in the healing tissue. So it is important that the use of analgesic to be limited only on based on the prescription. So I'm being a sports physician, I preferably avoid kind of prescribing NSAIDs in an acute setting. Probably if the pain is so high, in a range of say 8 to 9 out of 10, the individual is grossly affected and the pain is not subsiding even with the paracetamol 650 milligram used 3 or 4 times in a day, still that it is not having any effect on the pain, then I would prescribe NSAID for a combination with paracetamol. That has a 1 or 2 dose thing to reduce that pain for that particular period of time. But then use of NSAIDs routinely as a treatment modality is not recommended. The last goal of phase 1 is maintaining the function. How do you maintain? So in phase 1, the hallmark is that there is loss of function. Is one of the cardinal signs of inflammation, right? So main thing is that because it's a protective response because of the inflammation of the injured area. So you generally have the muscles surrounding the injured part are inhibited, so body protects and then avoids activating this muscle fibers. So it is important to somewhat activate this muscle which are around the injured area. And limitation would be because of this impairment, there is limitation or the swelling and the other signs of inflammation, there is limitation in the range of motion. So it is important to also remove this limitation by increasing the range of motion. So range of motion, as we discussed in the previous lecture also, how do you plan to kind of address this range of motion? Range of motion can be addressed by gradually doing passive, moving on to an active assisted, and thereafter to an active doing the pain-free range of motion. So in phase 1, controlling the inflammation and modulating the pain results in increasing the confidence, reducing the swelling and muscle inhibition, because of which you will have better range of motion, the function will improve and the impairment will reduce. Hence, it is important that the inflammation control and pain management forms the important strategies around the phase 1. Further, how do you improve the range of motion? First thing, you can also use manual therapies or mobilization techniques in the acute phase to kind of reduce the swelling as well as to cause minimal range of motion, mainly at the level of the joints. So when in biomechanics, you have two different types of movements. One is the osteokinematics, the other one is the arthrokinematics. So here in soft tissue mobilization around the joint, generally it's the arthrokinematics. You try to kind of give slight mobilization around the joint. Say for example, if it is an ankle injury, so you hold the ankle, support the ankle nicely of the patient, and then try to do an inversion, eversion, as well as an plantar flexion, dorsiflexion slowly in a controlled way, having look at the face of the individual. So that gives an idea whether the individual is in severe pain or not. So the movement gradually kind of helps in mobilizing the ankle and also helps in moving the the extravasated fluid which is accumulated around the joint. So that is one way of reducing the swelling, and it is found to also have better effect. The other thing is by causing a passive range of motion. So you can support the ankle at the sole of the foot and then try to do a dorsiflexion along with it, and then so the range should be again based on the pain-free range. You should not reach the range where the pain actually starts. So just below that, do, and then kindly you can modulate it accordingly. Gradually, as the individual swelling and pain reduces, you can move on to the next stage of active pain-free range. So is also an important opportunity to address on the range of motion and the joint above the injured area and joint below the injured area. So that also helps in further progressing with the subsequent phases of rehabilitation. Say for example, an individual has an ankle grade 2 injury with a moderate level of swelling and pain. So to start with, what I would do is do a passive ankle mobilization and progress it to an active pain-free by asking the individual to do an home-based range of motion exercise. Say I would ask the individual to do to draw alphabets in capital letter A to Z. So the individual should imagine that the individual is moving or writing the alphabets with the tip of the great toe. So making only movement at the level of the ankle. So imagine if this is the ankle, so you will ask the individual to use the great toe to make A, B, C, D, E. So like that, A to Z. So the size of the alphabet determines the range of motion. So initially, because of the pain and the swelling, the size may be smaller, but as the individual keeps on moving, there's a feedback from the individual himself or herself, that over a period of time the size of the alphabets may increase. So that can be a good objective way of asking the patient to have a target. So when the individual comes back after some time of phase 1, so you can reassess what is the kind of ability of the individual to do the range of motion of the ankle. So that's one of the easy way. So moving on to a case scenario. So coming back to the same case which we introduced, you are part of a sports team training few kids to play football, and the individual sustained a injury to the back of the thigh, and you as a trainer or a coach or a therapist, what would be your role in the immediate on-field management? So to explain it to you, the first step would be to follow a price or a police protocol, so which is very important first step. The second step would be to protect the injured part, so that is the foremost thing. So obviously you would stop the activity, unload the injured area. So you unload the injured area, you can use some crepe bandage or wraps to provide the compression around the uh, thigh region, and you should have adequate availability of ice packs, so that you give an ice pack compression for 15 to 20 minutes, and then in case the swelling is still present, then it is advised to raise the limb, so that will kind of reduce the swelling. In case the swelling is not there, so it may not be a tear, it may be simple cramp also, so in that case you can also go for a passive stretching if the swelling is not there, in a controlled manner, so that the individual will recover from the cramp. So this will be the way how I would approach if I was a coach or a trainer or a therapist in the on-field management. So subsequently you assess the condition. If the individual is recovered, it's fine, then you seek some medical assistance, so that further stages of rehabilitation can be planned. So when you come to implementation of this on ground, first main goal is impairment to be addressed, and then restore the function. Limitation is in the terms of range of motion, that has to be maximized. It depends on the individual, so and the extent of the injury. So you have to give importance to the individual's response, body response. Coach and trainer plays a pivotal role, so it's important to collaborate with them, know the timelines, make criteria based this thing, and they also provide the important support to the athlete, because coach is the first immediate contact with the athlete, so it is important the coach and the trainer give support to the athlete during the injury phase. There may be limitation in terms of their resources, but at least basic resources in terms of availability of ice packs or some crepe bandage should be made available in most of the thing. And it also varies with respect to the type of or the level of athlete. A recreational athlete or amateur athlete will have other commitments also, but then in a maybe lack of access as well. So accordingly, the control of inflammation and pain modulation has to be addressed. It's important to provide complete education to the athlete, so that the adherence is also an important aspect. Further, in the acute phase, the emotional response run high. So an athlete participating in the sports actually improves the level of endorphins, and then gives a good feeling, and suddenly to being stopped from not further participating because of the injury, not able to participate, so that it's a lot of emotional trauma. So it is important to counsel the individual during the acute phase, and that is important in terms of that helps in kind of improving the confidence over the period of time. And last but not least is the adherence. As we mentioned previously also, adherence is determined during the acute phase depending on the therapist's role. So how well you are able to explain to the individual the various pathological process and how it kind of is going to progress, and what is the timeline based phase wise rehabilitation, that kind of improves the adherence level. And with this peer support, and make him discuss with individuals who have had previous similar kind of injury, and then how they recover and then being back to sport, so that also boosts the adherence as well as the confidence of the individual. And obviously using technological aids will help in further promoting this particular aspect. So having known about various strategies to be employed during the acute phase, how do you progress to the subacute phase? There should be some criteria, right? So the progression is basically when you have done the activity modification, pain modulation, and have achieved a certain level of range of motion, so that you are able to go to the next level as a objective criteria. So there should be some amount of strength gain also, with individual able to move further to a basic function with some minimal discomfort. So I would say in a scale of 10 to about 4 to 5 is okay to progress to subacute phase. In the acute phase, maybe around 7 to 9. Reduction to about 4 to 5 is a good kind of improvement in terms of the restorement of the function. that is the time you can decide that you can go to subacute phase. However, it is important to make sure that you have some prefixed level of range that is required to further progress the strength and the activity of daily living. And this should be a objective way to also assess the pain and the swelling reduction. So it can be by means of subjective symptom based assessment from the patient, or you can also measure the swelling size, or rather using a visual analog score to score the pain reduction because of the phase 1 rehabilitation that you have done. So that gives a good idea to progress to the subsequent phase, that is the subacute phase. But during the entire phase of rehabilitation, it is the social support which is very important from the coach as well from the administrators. To summarize, so the acute phase of rehabilitation starts at the field of injury itself, and it is important to create awareness about the price and the police protocol for staffs involved in sports, because not in every kind of sports being played they'll have a qualified therapist or a qualified medical personnel. So it is important that those who are there as a support personnel, they should have this basic knowledge of providing the basic on-field management for the injury. Some items like ice cubes, scrub bandages, coolants and pain sprays should be part of your first aid kit during the sports training program. Protecting the injured part goes a long way in terms of preventing the complication and the damage. So it is important to have the appropriate protection that is available on the site. Controlling the inflammation and pain further kind of improves the adherence level to the rehabilitation program. And as I had mentioned, it is important that the coach supports the athlete during the program of sports rehabilitation for the individual to be more adherent to the program and prevent re-injury. For those of you who are interested in further in-depth reading, these are the references that I have flashed here. So you can use these references to have in-depth knowledge. Thank you and Jai Hind.